It's Patrick Hutzel from intensivecarehotline.com, where we instantly improve the lives for families of critically ill patients in intensive care so that you can make informed decisions, have peace of mind, real power, real control, and so that you can influence decision making fast, even if you're not a doctor or a nurse in intensive care. This is another episode of Your Questions Answered, and in last week's episode I answered another question from one of our readers, and the question last week was, my dad is in ICU with pancreatitis. When can they wean my dad off the ventilator? You can check out last week's question by clicking on the link below this video. In today's episode of Your Questions Answered, I want to answer questions from one of my clients, Bong, as part of my one-on-one consulting and advocacy service. Bong's mum is critically ill in ICU, and Bong is asking how can he stop the ICU team from being negative about her mum's condition. So today's question is, how can I stop the ICU team from being negative about my mum's condition? Help. So Bong writes, "Hi Patrick, I have seen your website and it is providing very good information. That is why I decided to send you an email and sign up for your consulting and advocacy sessions. The past 7 days, my mum has been off any pain medications or sedatives. In that time, the ICU only ran trials to determine if she would stop breathing. She failed 2 times in the past week when she was tested while sleeping, and they reduced oxygen to room levels and air pressure support was 10. She has had no failures to breathe while awake. There has been no weaning her down to 8, 9 or 8. Yesterday I got a therapist to run her at 8 and with room air, and she tolerated that for 2.5 hours before it brought on gagging. Sunday morning, when I was not there, they tested her while asleep at 10 and room air, and she stopped breathing 5 times. I suspect it was due to having run her at 8 yesterday with no additional help during the night to rest and recover. I do not remember that she spent the night at likely 12 and room air. The 5 failures to breathe shoots down my efforts to get them to wean mum at lower pressure settings. I was observing all but a few of the ICU's therapy sessions, and in none of them did they reduce the air assist below 10 in order to wean my mum off the ventilator. This happened for the past 7 days. When a therapist did so yesterday, my mum breathed for 2.5 hours with oxygen the same as in the room. I confronted them and they admitted they had never been below 10 before except to test mum at 5. I told them going from 5 to 10 and expecting my mum to perform at 5 without any weaning at progressively lower pressure 6, 7 and 8 ensures failure. Their response was, before waking mum up, they performed spontaneous breathing trials, which she failed 5 times. So there never was any reason to wean mum to 5. I have asked for mum's vaporizer records for the past week of being off sedatives to see how often she stopped breathing on her own. I will have the records tomorrow. Mum has had an existing stroke injury that the medical staff says is likely why she now stops breathing. I suppose we could wait longer to see if this goes away, but I doubt it. That is a question for those that specializes in stroke damage. From Bong." Hi Bong, thank you for being a client. I really appreciate it. The biggest challenge for families in intensive care is they don't know what they don't know. They don't know what questions they need to ask, and worst of all, they don't know how to manage intensive care teams. Most families in intensive care feel completely powerless, and they think that they have to look up and, even worse, suck up to the doctors and the nurses in intensive care, and they are at their mercy, and nothing could be further from the truth, especially if you know how to manage them. If you know what questions you need to ask, and if you get professional consulting and advocacy here from us at intensivecarehotline.com, because we understand intensive care inside out, then we can help you very quickly to make informed decisions, get peace of mind, control, power and influence in those situations. Can you, as a next step, please send me a picture of the ventilator, an arterial blood gas result, a picture of the bedside monitor, recent chest x-ray results, kidney function such as urea, creatinine, bun levels. Also, please send a list of current medications your mother is on to begin with." Bong writes back, "Hi Patrick, I will have the medical records Monday morning. I don't know if it will give the name of the ventilator or will include the x-rays. Her lung x-rays are clear. I was just told A small collection of fluids are still in the lungs at the time of the last x-ray. My mum is producing a few tablespoons of discharge from the lungs in the last 24 hours. A small amount of possibly dry blood came up yesterday. Mum had a collapsed lung which has since fully recovered. The chest tube is out or has been out for 5 days. Mum is off all antibiotics for the past 5 days. No sedatives or pain medications for 7 days. Mum has a failing heart valve and strokes. The doctors are trying to claim the stroke has damaged her brain and that is the reason she stopped breathing. But that doesn't jive with the 2 prior times she stopped breathing early in her recovery. Yesterday's incident came right after pushing her until she failed at 8 and not giving her any extra O2 to recover overnight. Mum has no history of kidney problems. My brother, with a private practice in infectious disease, will be here tomorrow when we will meet again with the staff who are trying to disconnect Mum. He headed off prior efforts by the hospital to deny Mum the ICU treatment even after the lung collapsed. There was a small air pocket in the lung that had to be drained. They claimed it was a major procedure. My brother corrected them that it was a quick bedside procedure. My brother could foresee the time for the lung to reinflate and stop the hospital from removing Mum before 14 days, the minimum for recovery. The hospital doctors are in their late 20s. Now they're selling this stroke as a reason for Mum to stop breathing. If that was the case, it would be happening daily. The prior 2 breathing stops were early in Mum's recovery when she was under stress. They did not reappear until I pushed Mum's rehabilitation. From Bon. Hi Bon. Extubation is the removal of the breathing tube or endotracheal tube after intubation on the larynx or trachea, which is also known as the windpipe. The purpose of extubation in intensive care is to take the patient off mechanical ventilation so that the patient is able to breathe on their own without any mechanical ventilator. Quote unquote, normal extubation parameters are PEEP-O5, pressure support less than 10, FiO2 less than 30%, breathing spontaneously, good strong cough, can obey commands, minimal suction required, good tidal volumes. This is if someone has an arterial blood gas result, as well as that confirms readiness for extubation on those parameters I mentioned before. A stroke could potentially hinder swallowing properly, hence risk for aspiration post-extubation. Please get more of the facts for a good assessment so we can take the next steps. Bong writes, Hi Patrick, Mum's PEEP is consistently over 5. I have never seen it below. The pressure support has run constantly at 10 for the last week with occasional 12 and 14 to assist in recovery from trials. At room air for last week, no effort was made except once to go below 10 once. This was without a doctor's authorization. Obeying commands, but spends long periods sleeping and difficult to get awake, which ICU doctors encourage even when they are supposedly performing a trial. The therapist wants Mum alert when performing trials. If what appears to be gagging is actually an effort to cough, then a strong cough. I have noticed less frequency of this coughing, and less mucus from the lung tube. The doctors prefer to mislead with the claim Mum cannot protect her airway, but they do not explain that this has to do with a strong cough. It is another ploy to justify ending her life. There is now less and less need to put the suction tube down to her lungs to clear and extract mucus, only when she has coughing fits. Those fits came about when I ran her at 8, also when left at 10 for long periods. When the therapist ran her at 8 for 2.5 hours, the therapist was very pleased with her performance. That was followed the next morning by 5 stop breathing events, which the doctors have seized upon to renew calls to end her life. The therapists rotate every 12 hours. I do not see the same ones back for days. There is no one therapist that knows Mum's case. They depend upon rotating doctors who issue commands and never oversee the treatment or end results. I am sending the hospital's ICU weaning treatment. Nothing on gradually reducing air pressure. Mum shows every sign of achieving 5, but they seize upon every excuse to call for end of life one of the therapists cooperates with the doctors selling the 5 not breathing events Sunday morning as a reason, claiming it is evidence of brain damage. Regards from Bong. And this one-on-one consulting session will continue in next week's episode. So, how can you become the best advocate for your critically ill loved one? How can you make informed decisions, get peace of mind, control, power and influence quickly whilst your loved one is critically ill in intensive care? You will get to that all-important feeling of making informed decisions, get peace of mind, control, power and influence when you download your free Instant Impact Report now by entering your email below. In your free Instant Impact Report, you will learn quickly how to make informed decisions, get peace of mind, real power and real control, and how you can influence decision making fast whilst your loved one is critically ill in intensive care. Your free Instant Impact Report gives you in-depth insight that you must know whilst your loved one is critically ill or is even dying in intensive care. Sign up and download your free Instant Impact Report now by entering your email below. In your free Instant Impact Report, you will learn how to speak the secret intensive care language so that the doctors and the nurses know straight away that you are an insider and that you know and understand what's really happening in intensive care. In your free report, you will also discover how to ask the doctors and the nurses the right questions. Discover the many competing interests in intensive care and how your critically ill loved one's treatment may depend on those competing interests. How to eliminate fear, frustration, stress, struggle, and vulnerability even if your loved one is dying. You will get 5 mind-blowing tips and strategies helping you to get on the right path to making informed decisions, have peace of mind, control, power and influence in your situation. You will get real-world examples that you can easily adapt to your and your critically ill loved one's situation. How to stop being intimidated by the intensive care team and how you will be seen as equals. You will get crucial behind-the-scenes insight so that you know and understand what's really happening in intensive care and how you need to manage doctors and nurses in intensive care, and it's not what you think. Thank you for tuning into this week's Your Questions Answered episode, and I'll see you again next week in another update. Make sure you also have a look at our blog section for more tips and strategies, or simply send me an email to support@intensivecarehotline.com with your questions. Also, have a look at our membership site intensivecaresupport.org for families of critically ill patients in intensive care. You can also call me, find phone numbers on the top of our website. Also, have a look at our ebook section, and you can also get one-on-one consulting and advocacy with me over the phone, via Skype, via Zoom, and via email by clicking on the relevant tabs on the top of the website. This is Patrick Hutzel from intensivecarehotline.com, and I'll talk to you in the next few days. Take care.